This is the world of the campus vets.
It's now a mystery. We're hoping that this is something curable.
I've never done a physical on a turtle before. It's kind of exciting.
And puppies with Mickey's condition typically die by the time they're 1 or 2 years of age.
At the Western College of Veterinary Medicine, students in the teaching hospital learn to save the lives of animals under real-world conditions. Mocha is gravely ill. The toy poodle can scarcely walk. Greg Gerspacher knows his dog is in pain.
She used to be a very energetic, very enthusiastic dog that needed to participate in everything. And all of a sudden, she's just stopped trying to be a part of our lives. My wife got Mocha about a year ago before we got married, and she loves her to death. Mocha's really touched both our lives. And there's not a thing that we wouldn't do for her.
Sandy Jameson is the student assigned to Mocha's case.
She lost a lot of body condition, a lot of weight since.
About a quarter of her body weight.
Really? Wow. One of the most significant things is that she's a 3-year-old toy poodle that's just laying there and really doesn't want to do much of anything else. She's very, very thin. You can actually feel her backbone really easily, and the muscles pretty much throughout her body seem quite atrophied.
The most distressing symptom is the weakness in Mocha's hind legs.
Can I go get him? Okay. Yeah. I think obviously there's something serious going on, and hopefully we can find out what it is.
Across town, it's time for Frodo and Stumpy's annual checkup. But first, the box turtles will have to finish their lunch of bananas and worms. Owner Rebecca Clark will just have to wait. And wait. And wait.
Oh, beautiful. So which is which again?
This one's Stumpy, the girl. And
Stumpy's the girl and Frodo the boy.
Student Laura Twardzik will conduct the turtles' exam.
I've never done a physical on a turtle before. It's kind of exciting.
Mickey, an orphaned 11-week-old puppy, has a serious problem with her heart.
Ah, little one. Come on, monkey.
Marcia Way is the lead veterinary student assigned to her case.
I'm just going to listen to her heart, do a brief physical exam here. Mickey's heart rate is crazy. It's so loud, and you can just hear a lot of background. It's just a continuous swooshing sound. Oh my goodness, huh? Come on, you.
The cause of Mickey's strange heartbeat becomes clear when Marcia reviews the puppy's x-rays with faculty surgeon Dr. Lynn.
Wow, what do you see?
Her heart looks enlarged.
So how big would you reckon her heart ought to be?
I think, isn't it usually 3 rib spaces?
And we've got 4 here, so she's way too wide.
There's a duct between the aorta and the pulmonary artery in the heart. It usually closes on its own in the first 24 hours after birth. In Mickey's case, it has stayed open, sending too much blood into her lungs. It's a life-threatening condition known as patent ductus arteriosus, or PDA.
Puppies with Mickey's condition typically die by the time they're 1 or 2 years of age. Things just go bad all of a sudden and they can't breathe anymore.
Surgery is considered the only option to save Mickey's life. Laura Twardzik is learning how to perform a physical on 2 box turtles with some help from faculty veterinarian Dr. Parker.
Let me take a quick peek at this one and I'll show you. It can be difficult to do a physical. You can do an abdominal palpation by putting your finger, just cranial, to both back legs, and you can feel if there's abnormal masses in there. These turtles are getting pretty old, and so just a lifetime of living in captivity, not eating a very hard food, not eating a natural food, not having to fend for themselves, that kind of thing, their beak just gets overgrown naturally.
Both turtles need a beak trim, a procedure that is more challenging than it sounds.
The trick is getting them to keep their head out. So we usually anesthetize them for this. So pull back a little bit, and then I go quite fast because it stings, and just a little bit of pressure. And then use the thumb
Now
to
it's
press it
Laura's
up,
turn
pull it
with
off.
Frodo.
Really have a good grip of that foot.
And I'm sticking.
Hold your syringe properly, so you can pull back and inject.
Okay.
The turtles can run, but they can't hide. As soon as the anesthetic kicks in, the beak trimming will begin. Mocha is wasting away. The toy poodle has lost a quarter of her body weight and is having trouble walking. Student Sandy Jameson hopes her supervisor, resident Dr. Cheryl Vargo, can shed some light on the case.
Is that how she normally holds up her leg? I have a feeling it's going to be one that is not going to be simple, you know, in terms of getting a diagnosis. Hi.
Hello.
I'm Dr. Vargo. How are you?
Good. How are you?
Good. Well, looking at her, I mean, she's one that unfortunately is going to take a little bit of detective work to try and figure out what's going on with her. I like to have the surgeons have a look at her. I think it would be important to repeat her blood work just to see if there's any changes.
Greg agrees to leave his poodle at the clinic for a series of tests.
We're hoping that this is something curable and something avoidable in the future.
Do you mind walking her up and back for me a couple of times? She'll just
After taking some blood and urine samples from Mocha, Sandy and Dr. Vargo consult with resident surgeon Dr. McDougall about the dog's hind legs.
Come on, honey boy. Come on. She does actually walk sometimes.
She, again, is fairly reluctant to let me extend her knee. She's not doing that well, are you, kiddo?
They suspect a joint disease, so they plan to take samples of Mocha's joint fluid. But then a shock. The results of Mocha's first blood test. It turns out her legs are the least of her problems. Coming up, the vet students are elbow deep in their work at a local dairy farm. The blood tests are back on Mocha, providing clues to the dog's mysterious problems.
We have decreased urea, cholesterol, and albumin, which is interesting. That suggests that there's a problem going on with the liver.
There, who is brave?
All attention now shifts to Mocha's liver. More blood samples are taken, this time focusing on the level of bile acids, which the liver normally removes.
We feed them a small meal, maybe 2 tablespoons of a high-fat diet, and then we take a blood sample 2 hours later. Basically, if the liver is functioning normally, those bile acids should be within the normal range. If the liver is not functioning normally, then we're going to see bile acids much elevated.
While they wait for the test results, they hope ultrasound will help give them a better picture of the condition of Mocha's liver.
We're looking for anything discrete, any discrete nodule, mass, cyst, anything like that in the liver itself. You know, to biopsy.
Dr. Tryon from the medical imaging faculty doesn't see any tumors, but she's noticed the organ is smaller than normal and it's showing up brighter than it should. A bad sign.
That to me then would make the higher likelihood that the liver is abnormal.
Here we go, Mocha girl.
They suspect that Mocha has a liver shunt, a condition that interferes with the organ's ability to clean the blood. There is no guarantee that surgery can correct this problem.
Want a drink of water, girlie? Hey, are you thirsty?
Things go from bad to worse when the results from Mocha's bile acid test arrive.
High end of normal range is 20, and hers is all the way up to 147. That is very significant.
Mocha's liver is in such poor condition, it can't prevent toxins from flooding her tiny body.
Unfortunately, the long-term outlook for her is quite poor.
It's one of the most difficult parts of the job, calling an owner with bad news.
Come a little bit closer.
The two box turtles are ready to have their overgrown beaks trimmed down, starting with Frodo. The procedure is painless for the turtles, thanks to a shot of anesthesia.
We just smooth it out and take it down a little bit and make it a little bit easier for them to eat.
Oh, look at you. You look like you're smiling now.
Stumpy is alert, but Frodo needs to recover from anesthesia before they can go home. In typical turtle fashion, he's in no rush. Mickey, an orphan puppy, has a life-threatening condition called PDA. A defective vessel in her heart is sending too much blood into the lungs. If the condition is not fixed surgically, it will eventually kill her.
I'm gonna get ready to scrub in for surgery. Mickey is anesthetized and on the table waiting for us.
Student Marcia Way will assist surgical resident Dr. Gillick and faculty surgeon Dr. Lynn.
Jess,
I think it's a very exciting case. I've never seen heart surgery before.
This type of operation is extremely rare and provides an invaluable teaching opportunity for the college.
So Mitch is going to make the approach in between the 4th and 5th ribs.
There is no room for error in heart surgery.
The blood vessel that we need to tie off is located in a rather inconvenient place around, well, the pulmonary artery and the aorta, and a hole in those vessels could be fatal.
Dr. Vargo breaks the bad news to Mocha's owner, Greg, that his poodle has a chronic problem with her liver.
The only way to definitively find out what's going on is to do basically an exploratory. Unfortunately, her long-term prognosis, whether we go ahead and do this exploratory or whether we don't, it's poor. In regards to her lifespan, it's going to be quite short. It actually gets quite depressing at times, and it's something that, to be honest, we do, go home and cry at night about these little guys, because I mean, again, she's only 3 years old, she's very sweet, and to be delivering this kind of news, I mean, it's devastating.
An hour drive from the college, the vet students are making a house call at a dairy farm. They'll be conducting pregnancy checks as a part of their training in field service under the supervision of faculty veterinarian Dr. Carruthers. Student Emma Agg is already an old hand at rectal palpation, the most common method of evaluating a cow's reproductive system.
I stick my hand up the rectum of 100 cows in a day and don't think anything of it. A cow has to be pregnant in order to lactate, in order to give milk. And we milk them for about 6-7 months. Then we dry them off for 2 months, and then they give birth and we milk them again. And that's sort of the life of a dairy cow.
They come across a cow that is worrying her owner, Lloyd Sawatsky.
I don't know exactly. She wouldn't get up. She was just laying down all the time. And when she gets up, she's hunched up. She's definitely not feeling well.
The cow's heart is racing.
120?
120 beats per minute is much higher than what it should be. A bad sign for a cow just 2 months away from giving birth. Open heart surgery is being performed on an orphaned puppy named Mickey. The surgeons need to tie off a defective blood vessel called a ductus.
Okay, so this is a big bulgy ductus. She would not have lived long.
A simple touch can detect the backwash of blood that is threatening the puppy's life.
Put a finger there.
You can actually touch the aorta and feel that thrill that's coming off there. Very interesting. I've never ever seen or felt anything like that before. It's just like a little vibration on your fingers. It's almost like little bees buzzing.
When we finish tying off those sutures, that buzz should be gone, and that tells us that we've gotten the ductus tied off effectively.
The vessel is successfully tied off. Now excess blood won't wash back into Mickey's lungs.
I think the surgery went very well. It was very nerve-wracking at times, but I think it went great.
She should be cured now, so that's a nice thing about PDA surgery. They're a little bit scary while you're dissecting out the vessel, but it's very satisfying because you take a puppy who is going to die and turn her into a puppy who will have a normal life.
For the first time in Mickey's life, the orphaned puppy has a healthy heart. Now all she needs is a home. Frodo and Stumpy are recovering from anesthesia after their beak trims. Laura checks the heart rate.
That's doing pretty good. He's just a little slow to wake up.
Time for the turtles to go
A
home.
little bit slow yet.
There's never anything that walks in the door that's completely the same as the last one. That's true for most of veterinary medicine, but it's especially true for exotics. Up to this point, I've had absolutely no experience with turtles, and I think I learned a lot.
At a dairy farm outside of town, one of the pregnant cows is ill. Emma Agg, the lead student on this case, is trying to figure out why.
She wasn't eating, and she's kind of standing. You can kind of see she's standing a bit hunched over as if she's in pain. She just doesn't look right.
Not only is her heart racing, it's sounding strange on one side.
Where you should normally hear like a normal heart sound, boom, 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 like that. Kind of sounds more like a washing machine. It's like whoosh, 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 like that.
The elevated heart rate could indicate pain. The veterinary team suspects the cow has likely swallowed a piece of metal.
Well, when you're making feed, you often get pieces of machinery that'll fall into the feed, pieces of steel or nails or wire, and the cows will eat that, and that'll cause problems.
If left untreated, the metal could migrate and damage internal organs.
All right, here we go. Hey, sweetheart. How's she doing today? Oh, she's doing great. Pretty sad.
Mocha's liver disease is chronic, but the toy poodle has perked up thanks to medication that reduces the toxins in her body and a new low-protein diet that puts less stress on her liver. This is the option that Mocha's owner, Greg, has decided to go with for the time being.
Surgery was certainly an option, but that was a little risky considering that her liver isn't working as good as it should be. We were scared that that would be too high of a risk for us and for Mocha. Oh, hello. Hi. Oh, hello.
Mocha is more energetic and her hind legs are no longer causing her grief thanks to pain medication. However long the poodle has left, there's no doubt Greg will make the most of it.
You know, her prognosis is poor, but now that we know, regardless of what the outcome is, at least we know we can do something about it, and you know, by chance, maybe we'll get an extra year or 2 or 3 or 4 out of her.
I just hope that, you know, they can spend some good quality time with her and she'll be happier at home.
Greg hasn't ruled out surgery down the road, but for now, he just wants to bring his dog back home.
Ready to go home, puppy? And we're going to spend every single second we have with her for the rest of her life.
Coming up, a strange case of animal magnetism.
Follow it, girl.
Student Emma Agg is facing a pregnant cow with a racing heart rate and lack of appetite. These symptoms suggest the animal may have swallowed a piece of metal that is now traveling out of her stomach and irritating other organs. Dr. Carruthers has a treatment plan.
Things actively. We'll give her a magnet. Okay.
A magnet will hopefully draw the metal object back down into the stomach, away from other organs it could harm.
This is called a balling gun. So it has a kind of like a little plunger at the end. So you stick the magnet inside here.
You put your hand in her mouth, Emma, on the far side, and lift up on her hard palate. Just slip it in, yeah, and then she'll open up.
It's the day after Mickey's heart surgery, and the orphaned puppy is recovering quickly.
So that looks really good. I think that we're just gonna leave her bandages off. You look good, hey? Yeah, pretty girl. So now what we wanna do is send her off to her new home. We have a family that wants to adopt her.
Come on, let's go.
It's your mom! Look! Who's that?
Nicole Kint, a friend of one of the college staff, is thrilled to give Mickey a home.
She's gorgeous. Look at you. See? Look at you.
Mickey's been a pleasure to deal with. It's been such an interesting case to be a part of and interesting surgery to see. And it's nice to see a happy ending as well.
Look at you.
Swallow it, girl.
Yeah, it's gone.
The cow finally swallows the magnet.
Thank you.
They will check back on her condition on the next visit. It's been a successful day for Emma, who has never worked with large animals until just a few years ago.
Being a city girl, you do get a few people that say, because you haven't lived it, you can't understand it. I don't think that's true. I think you can learn those kind of things as long as you're open and you're willing to ask lots of questions. Bye.
You are a good little girl, aren't you? Hey, good girl. Yeah, you're good. Yeah. Hey, don't do that. Please undo my shoe, huh? Okay, let go. Come on, stinker. Let's go back in. That's why I wonder how people can have a litter of puppies.